My name is Sarah Peterhans. I'm 26 from Chicago, Illinois. I started riding when I was in grade school, about 7th grade, and I've been riding on and off ever since. I remember going over the jump, I remember the takeoff, and the next thing I remember I was flat on my back and the horse and I were on the other side of the jump. The wind was knocked out of me, which was really scary for me because that had never happened before, and then my back was in excruciating pain. So right after I fell, I stopped at urgent care. They did some x-rays, gave me some muscle relaxers and prescription ibuprofen, and then sent me home. They called me a couple of days later and said that there was a possible fracture, but the only way to tell would be if I got a CT scan. So I got that. They called me the next day and said that there was a 25% fracture on the T12 vertebrae. They gave me a list of doctors, spine specialists to call to get an appointment, and all of those doctors weren't able to get me in until like the following week. So I got Dr. Virella's name and called them, and they saw the urgency in my injury and they were able to get me in immediately. When I saw Dr. Virella, it was a little bit nerve-wracking. I went in expecting, here's a back brace, wear that for a couple of months and be done with it, but his recommendation was surgery immediately. So I asked him what other options we had, and he did say that we could do a back brace for a couple of months, but his hesitation with that was that my back would heal wrong or I could potentially do more damage than good doing that way, and he thought it was best to do the surgery. So I was still really hesitant, just never having surgery before and being just uncomfortable with that idea. And for him, he knew that my dad had had back surgery the previous December and my brother-in-law was a doctor. He offered to actually talk to both of them just to help me feel more comfortable with the whole idea. And he did actually talk to my brother-in-law, explain the pros and the cons and the benefits. And my brother-in-law was able to bring it back to me and my family and to explain this is why it needs to be done, this is the importance of it, and made me feel so much more comfortable having surgery with Dr. Virella.
I first met Sarah when she was referred to me by the local urgent care. Sarah had fallen off a horse several weeks ago and she sustained a spine fracture. She was initially treated with conservative care and pain medications. I quickly realized once I looked at her x-rays that she had a fracture that needed surgical stabilization. It was an unstable fracture. But what we were able to do for Sarah is essentially fix her spine, stabilize her spine as an outpatient. So we were able to fix her fracture, get her home the same day utilizing minimally invasive fusion techniques.
And in November of last year was when I was able to ride again. So I immediately, once I got the all clear you can ride, I found a barn, got back on a horse, and have been riding ever since. As far as pain now, I'm really not in pain at all. I continue to stay active, just to keep up those muscles, to keep my abs strong, to keep my core strong, so that I don't, when I get tired, it doesn't go into my back. So now I'm basically pain-free.